Bone, muscle, and joint injuries.
Musculoskeletal injuries can occur in many different ways, and there are 4 basic types.
The 4 types of musculoskeletal injuries are a fracture, which is a break, chip, or crack in the bone; a dislocation, which is a separation of a bone from a joint; a sprain, which is the tearing of ligaments at a joint; and a strain, which is a stretching or tearing of a muscle or tendon. This is usually called a pulled muscle.
First aid is the same for all muscle, bone, and joint injuries. Keep the person as comfortable as possible and avoid causing further pain. Just remember the acronym RICE. R stands for rest, I stands for immobilize, C stands for cold, and E stands for elevate. Get the person to stop any further movement and help them to get into the most comfortable position without causing too much pain.
Immobilize the injured body part to prevent further damage.
Apply ice or a cold pack to decrease pain and swelling. Cold will also constrict the blood vessels and minimize internal bleeding. To protect the skin, place gauze or a cloth between the ice and the skin.
Cool the affected area for 20 minutes every hour for the first 24 to 48 hours.
If possible, elevate the area above the level of the heart to slow the flow of blood. Do not elevate the body part if it causes more pain. If medical attention is delayed, the injury is minor, or you are in a remote area and 911 cannot access you, immediately immobilize the injured area with a splint, sling, or bandages to lessen pain and prevent further damage. A splint is a device that keeps the injured body part in place. There are 3 types of splints: soft, rigid, and anatomic. Soft splints include towels, pillows, bandages, and slings. A rigid splint can be made from boards, metal strips, or folded newspapers and magazines. Finally, an anatomic splint is using a healthy body part to immobilize an injured area, like fingers or toes.